Huh? Hey, I'm tryna win. I'm tryna win in the 716 and I'm making it big. I wanna live. I think I'm ready to.
Yo, what's good, man? It's Easy Pitch Out Podcast with your one and only host, Glory Boy, here with another special guest. Yes. I just want to say thank you so much for coming. It's been a minute. It's been a very long time since I've seen you. And I was like, it's Breast Cancer Awareness Month. Let me have Dr. Wanzer on my podcast so we can talk about it.
Well, I really appreciate you reaching out to me. First of all, it's a great opportunity to connect with you and to be in your studio, and also to share a little bit of information about breast cancer awareness and the importance of screening, and some of the things that I've learned in the last 2 years being in oncology survivorship and supportive services. Switching careers from higher ed and being a college professor to oncology survivorship has been a blessing and a gift to me to have the opportunity to work with oncology patients and learn about oncology and support them during arguably one of the worst, most difficult times in their lives. So thanks for having me.
Thank you so much. And before we even begin this, you guys go ahead and hit the subscribe button. Don't forget to like, comment, and share this video. And she already mentioned she was a professor. She was actually my professor in college. And you see, when you just keep that good connection, at the end of the day, you may need them for something, and here you are, so that way we can sit down and have an important conversation, because a lot of people don't sit down and actually look into this. It's a very serious thing that goes on. And also, you are a breast cancer survivor.
Yes, I'm a survivor working in survivorship.
Wow.
So, it's an interesting experience to be someone who, is still managing breast cancer, right? Who's still under surveillance and taking medication, but also managing a survivorship program and supportive services in the community. So it's interesting.
Wow. So let's take it back to the beginning of everything, because I know a lot of times you're basically just doing things on a regular basis, not knowing exactly what you're dealing with, what your body is carrying. But when did you find out that you had breast cancer?
So I think this is a great opportunity, and I know though cancer is not a fun topic to discuss, but I think it's a great opportunity to educate people on the importance of regular mammograms, but that mammograms aren't always they're not always as reliable as we hope for them to be. So I was getting yearly mammograms, and I don't have a strong family history of breast cancer. It really wasn't on my radar. I went in for my regular mammogram, and during the mammogram, the tech said that she noticed that asymmetry. So she noticed that one of my breasts, looked larger than the other one. I did not present with a lump, right? So roughly 85% of cancers are ductal, and so they present as a hard lump. Women will feel it. That's why we say self-exams and touch your breast and know what's going on there. I didn't have that. I had a lobular, which is 15% of women get that type of cancer. So I said, well, yes, I've gained weight, and I really thought I just gained weight, honestly. So I had my mammogram, and they suggested, how about you come back tomorrow, and we're going to do an ultrasound. And right before my ultrasound the next day, the person was like, we've looked at your mammogram from last year. There's no different from baseline. We're just doing this as a precaution. And lo and behold, during the ultrasound, they saw something. And so that seeing something, whatever they saw on that ultrasound, made them say, okay, now what? We're going to send you for more diagnostics. And I think that this is, I have to say also, full disclosure, and I don't, if others will agree with this that went through it, this is the worst time is the not knowing. I think if I look back and I go, what was really stressful, right? It was when you don't know, right? When you don't know what's going on and what's happening. So they sent me for more screening tests, for MRI, for biopsies, for PET scans and things like that. And I was diagnosed with lobular invasive carcinoma. So, lobular is a little more unusual because it doesn't present as a lump. So that's why I also want to reiterate, right, to women, if you have been told, and most women 40 and over have dense breasts, if you've been told you have dense breast tissue, right, you need to go for additional, you need to go beyond the mammogram and go for additional diagnostic testing. So whether that's an ultrasound or an MRI, but you need to make that a priority with your OBGYN. And, so my doctor had said to me, you're very lucky, Melissa, that this was caught at all. And so, I absorbed that feedback and felt like, okay, I gotta share this information with people, right? And so once I was diagnosed, it was fast and furious, right into chemotherapy. I had a double mastectomy. I had radiation, and I'm on what's called estrogen suppression, right? So because my cancer was ER positive, it responds, right? The estrogen is fueling it. I'm on long-term medication to suppress that estrogen called an aromatase inhibitor.
Wow, that's a lot of information.
I know. I know. You ask it to Blitzer.
No, and that's why it's important to have you here, because just being through that process and everything, you have so much knowledge that you're able to share with other women that may not know that they're going through that. But I know when the doctor told you one breast was bigger than the other, but were there like any type of symptoms that you were feeling in your chest?
No, nothing. I think that I also was a little bit in denial, that I would look and think, well, I see asymmetry, but I would kind of rationalize to myself and say, well, that's weight gain, right? And this is something that I've talked to a lot of women, and they said, you know what, we just want things to be okay. And we kind of convince ourselves sometimes it's okay, right? Because we're so kind of caught up in the grind of your job, your family, just doing life, right? Keeping everybody else healthy and, taking care of your kids. And I remember thinking like, yeah, maybe this looks a little strange, but, as long as my mammogram is okay. And also what's funny is I was in with my primary care doctor, and it was getting close to time to have a mammogram, and the nurse was like, you better keep on top of that. And I said, I don't have a family history, and but okay, and she said, you have insurance, Melissa, you really need to do that, and don't put yourself at the bottom right of the list, like you should be a priority. And I booked that mammogram like right after I talked to her, and within like 2 weeks, I was diagnosed with breast cancer. So I thought, wow, I wonder if and I told her, I wonder how long I would have put it off. Right. If she hadn't kind of haggled at me a little bit and said, come on, let's go. You better, harass me, come on, you got to be staying on top of this. Right. So, I'm thankful for her.
Right. And I feel like, a lot of times people always say, like you already mentioned, when they were telling you, Melissa, go get checked, go do this. Oh, I don't have it in my family. A lot of times we tend to think about certain things that we get to have in life. For example, different illnesses. Oh, it's because of the family genetics and all that. So let's actually talk about that. Like, because you mentioned that it was never in your family at all. But when you did mention it to your family members, what was their reaction?
So the new approach, right, is one idea is like, obviously, like I had genetic testing done, right? So, looking at your family history, right? So I did have a significant family history of cancer, right? My father passed of glioblastoma. My mother had skin cancer. So I shouldn't say I didn't have it in my family. I didn't have it in my immediate family. And honestly, I really didn't know anyone who had it, right? So that's another thing. So my dad's mother had it, and my great aunt did. So I did have it, but I didn't see it as like a real threat or something I should be concerned about. But I think that now, look at your family and look at their family look at your family history. How many people have had cancer, right? Because that's factored into the genetic testing. That's one of the things they use is, I remember filling out the tree, right? The family history tree of everybody who had cancer on my mother's side, my father's side. I probably filled that out like a half dozen times. And again, I went through genetic testing to see if I had the BRCA gene, right? Because then that's important for my daughters. And so now there is an approach to say, all right, what is your family history, right? And maybe you should have a mammogram earlier. So I'll use my sisters as an example. So because I had breast cancer, right, there might be another gene out there. There might be something that's being missed. They are now both getting mammograms and ultrasounds and MRIs regularly because both of them have dense breasts, and because we have, a pretty substantial history of cancer in our family.
Wow.
So
that is insane though. Like just with the women in your family, hearing that you have breast cancer now, it just puts fear in their hearts. Like, oh my gosh, like now, like let me go check too, because like you said, sometimes things can be genetic and sometimes it cannot. You just have to go check yourself and make sure that you continue doing those diagnostics. And also, let's say, at what age did you find out that you had cancer? Because also, it sounds like, because a lot of times when you're very young and people tell you you have something, sometimes you become very ignorant by saying, no, I don't. Like, no, I don't. Like, I know my body. Like, I'm still young. I'm still healthy. At what age did you find out that you had cancer?
Well, so I was 46, 47.
Okay.
I think I just turned 47. And the one thing you bring up age, and I want to share something with you that I've learned in this role. And again, I'm not a clinical person. And so full disclosure, hopefully I'm saying everything accurately, but my background and training is not in oncology, right? As an oncology provider, like a nurse, a doctor. But the one thing that I think that I would share is that unfortunately, we are seeing more cases, and ACS, as American Cancer Society, has reported this too, right? But we are seeing more cases of cancer in young people, really young people, Glory, like 20s. And so to your point, right, you are young, right? And so when you go to the doctor is looking for horses. This is like the saying, like, I think this is right. Horses, not zebras. Right. So when you say that something's wrong, the doctor's looking, she's looking for things that are kind of what she sees regularly, right? In people your age, right? With your health history. So she's not necessarily looking at you and saying cancer, right? And I'll use an example from many years ago. My boyfriend, who went to his doctor and said, I'm not right. And I'm experiencing pain and discomfort in my groin area. And the doctor said, you're fine. You're young, you're healthy, right? He was like 23, 22. And he went to the library and researched, and he came back to the doctor and said, no, I have testicular cancer. And he did, and it had spread through his body. And so I think about that, that doctor probably not seeing a lot of cases of, because it's thankfully relatively rare, right, or unusual. But if the doctor doesn't see it and diagnose it, then that's where their minds don't go there. Their minds don't go there. They're looking at you saying, you're young, you're healthy, look at you, you can't. And so I always told students when I taught health comm, and I said, you've got to advocate for yourself. If you are really concerned, and this isn't normal, you've got to push and say, hey, I think this is more serious.
Right.
Right. And so I tell that story not to frighten you, but to say, yeah, we're seeing more, unfortunately, more younger people presenting with cancer. And it's been like a long process where, unfortunately, it's not seen initially, and then it kind of drags on, and then it becomes more aggressive, and it gets tougher to treat. So,
Wow.
we have to, patients and young people, if you are listening to this message, right, advocate for yourself and say, something's not right. Can we do additional testing? I'm very concerned. Bring somebody with you to your appointment to have, to help you make that argument. But we can't rule it out, right?
That's true.
And we don't know what's causing it, but it's very concerning to me.
Yeah, and also let's take a look at like Mel. You mentioned your boyfriend back then did have some symptoms that he wasn't feeling well, but he will go to the doctor. In terms of like males, do men also get breast cancer?
Absolutely, they do. It's much. It's not as 1 in 8 women. 1 in 8 women will be diagnosed with breast cancer.
Okay.
That is an incredibly high number, right? 1 in 8 women. So count 8 women, 1 of them is going to have breast cancer in their lifetime. Now, men, it is not as frequent, but again, men can be diagnosed with breast cancer. And, obviously, this is something to pay attention to. Health history, if they have the BRCA gene, right, if they notice anything unusual, right, any pain, any discharge, anything unusual, right, bring that to your doctor's attention. But years ago, we did a testicular cancer campaign. I used to talk about it in class, and just talking about the fact that it's unusual, right? Like it's not a high number, but and it is treatable, but it has to be found, right? The earlier it gets caught, the better. So a self-exam, how many doctors talk to their male patients about how to do a testicular self-exam and what to look at for?
Right.
And when we were doing the campaign, we found that not many had. And when we talked to moms, we did a focus group, and all the moms had talked to their daughters. All the moms had talked to their daughters about breast self-exams, but they had not talked to their sons about testicular self-exams. And they felt very guilty, but no one had talked to them about it, right? And they're the husbands or, the male, the male figure, and they're like, they hadn't talked to the sons about it. So, there's a discrepancy there. I think at least it should be on people's radar, like, this can happen. Right. This is what you look for.
Yeah, that's true. And also, listen, fellas, man, anyone can get it. Anyone can get it. I mean, you heard it from Dr. Wanzer. I mean, she survived it. She's been learning about it. And this is why I actually I brought you here, so that way we can all just kind of like learn from it. And also, the most important thing also, and the most memorable moment for you was when you were going through your chemotherapy. You was going through your therapy, just dealing with cancer. Let's talk about that, though. How was the experience, and what was going through your mind? And as you see your family members, what was going through their mind as well, if you could tell. So, yeah.
Well, I can't remember, but I think you had me for class.
Yes.
So, I was very fortunate, and I'm going to say this because I want everybody to understand that everybody's cancer experience is different, right? And so I was lucky. I did my first round of chemo that was more unpleasant. I did that over the summer, and so I was off, and I could manage the side effects with that over the summer. I have very strong faith, and so that helped me. And I think I was very lucky. I had a great support network. I decided to teach, and a couple people were like, "Why are you doing this? Why are you working?" Right? And I'm glad I did. Right? I'm very happy that I stuck with it. Because I think it was a great distraction. I I just felt tired, right? I remember coming to class and just being like, I'm a little tired, but
Yeah, I remember.
I have runny nose or something. But I was really, really lucky because I was younger. I think I was healthier. I was healthy going into it. I didn't have any other significant health issues that kind of that can be a problem. That can determine how you manage, the chemotherapy. But I'll be very honest with you that I think because I put my head down and I just kind of I'm going to keep working and I'm going to just trudge along and everything's going to be normal, that I dealt with it later. That later it hit me what I went through, and it kind of knocked me down a little bit. Oh wow, that was, because it hit me later, and that's when I went to counseling and tried to really address my mental health and just kind of what that trauma, how it affected me.
So you go to counseling when you're going through the chemotherapy?
No, I go now.
Okay, so you
we are dealing with things that happened many years ago because
Right.
I put my head down at that time and said, you know what, I'm a mom, I'm a professor, I'm gonna just fight right through this.
Oh, most definitely. I mean, because you can't give up. You can't give up.
Right.
And so let me say, what was the worst pain? Let's describe the worst pain that you ever felt going through that process.
Well, you know what? And again, I'm going to tell you, everybody's different. And in their tolerance of pain, how they tolerate pain. I was really lucky. I didn't have a lot of pain, but I also think I have a high tolerance for pain. One of the things that I would say the most uncomfortable experience, right? And, I don't want to scare people, because one of the things I'd want to say to you is, and to everybody, is that, people come up to me and ask me chemotherapy and, all the things that happen to you, and, just throw up and, how much pain and, and I'd say, it's all managed. It's all managed, right? You have pain medicine, you have anti-nausea drugs, you have, steroids, you have things that they're giving you to help you manage the side effects of the chemotherapy. So as far as pain goes, I would say one of the more uncomfortable parts and more stressful was having one of the biopsies was very uncomfortable. And that sticks out in my mind, right? That to me was that one day was a very dark and miserable and unpleasant day. But the rest of the time, I'm not a martyr. I was like, all right, give me some pain medicine.
Yeah, and then you have to find a way to deal with it. You
do.
You have to find a way.
And everybody's different.
Everybody's different. That's true, because everybody deals with pain differently. Everybody have different pain. They tolerate pain differently. Yep. And also, actually, before we even started this conversation, we were addressing something very important in terms of different demographics, yes, different races, and so on. So let's talk more about that. Yep. So in terms of Black women, yep, because it's something that you wanted to bring up, and I feel like it's very important because we don't address this in our community as much. So in terms of Black women, so let's talk about breast cancer.
So we're going to talk about this, and this is one of the reasons I wanted to see you and come on and have this conversation, but I really wanted to make sure we covered this, and that is that, statistically, we know American Cancer Society and other cancer organizations put out information, right, each year on mortality rates, right? And African Americans have a higher mortality rate for breast cancer, and that is because they're diagnosed at a later stage, so it has progressed, and because they're more likely to have triple negative, which is a more aggressive type of breast cancer. So, we know this and we see this, right? I have experienced this, right? We have a grant with New York State with the Breast Cancer Network, and we have a program called Sisters in Survivorship. And we are actively seeking out Black women and African American women, women of color, to provide them with supportive services, mentors, and really opportunities to, educate, right, about the importance of mammograms and screening and, self-exams, right, doing self-exams and talking to people and saying, don't wait. If you feel something, say something. If you have a significant history of breast cancer in your family, right? If something about your body doesn't feel right, you're going to have to keep advocating for yourself, right? And that's something that I've talked to many Black and African American women, and they said, my doctor didn't listen to me. And that's horrible.
Right.
And I knew something was wrong, and I kept saying something was wrong. That's not right? That's horrible.
What advice did you give them, though? Because, their doctor didn't listen to them. What advice did you give them when they do go back to those doctors?
Well, first of all, I say go back and, demand, right? I need a script for a mammogram, for an MRI, an ultrasound, and also, switch providers, which I've talked to many, women who said, that's what it took. I had to switch doctors. I switched doctors, and this doctor said, yep, something's wrong, and they sent me on my way, right? But if that doctor is not going to listen to your concerns, right, then find one who will quickly, right? But I think it's really bad that women have to make a case for their own bodies and that they understand, right? This has been a consistent theme that I have, that these women have shared with me, and I think that's horrible.
Yeah, that's one thing too. A lot of times people don't really work as hard to help you out because they're not in your shoe. Yep. So like some of those doctors probably, because they're not in their shoe, they will feel some type of way. They will try to make decisions to try to tell you, oh, this is what you have to do. That's why sometimes when I go to doctors, I'll let them know I'm feeling like this. I know my body, and some doctors will be like, no, we don't see anything. No, but I still feel pain. It's like at one point, this is off topic, but I was injured with my knee as I was playing soccer. Every time I'm playing, I'm feeling pain. Every time I'm playing, I'm feeling pain. I'm like, something is wrong. So then I went to do MRI and everything. They said, there's nothing wrong. I'm like, what? I went to physical therapy for 3 weeks. After that, I went back to play. I felt pain again. I'm like, what's going on? After that, for some reason, I just kind of like stopped going there because the doctors would not try to do anything to see what's wrong. They will always tell me like there's nothing. And me, I would always believe them, but every time I play, I'll feel pain, which is the most weirdest thing, But just going back to the topic here, so throughout the organization, as you're mentoring Black women and other women as well, have you come across the young women, actually, who are also dealing with the same exact thing?
Yes. And it is absolutely heartbreaking. Because, again, going back to what happened with my boyfriend, I think this sometimes happens with young women, and that they go to the doctor and something is wrong. And, think about it. You're 27, 26. You're not having a mammogram. You know what I mean? Like you haven't gone to have a mammogram. You're just coming in. They're doing a breast exam. Maybe they don't find anything. Again, lobular isn't picked up. Oftentimes with younger women, it has to kind of advance, right? And then people say, oh, wait, this isn't right. But any pain, any discharge, anything like, just as you're saying, right? This pain, you're young and healthy. Pain shouldn't be there. You shouldn't have pain. Right? Like you're going back to your knee example. Did that pain go away? Did you ever get a second doctor's opinion? Like,
I just gave up, which is
But that's unfortunate.
yeah. But I'll go
right?
to somebody else, unfortunately, but because I haven't been feeling pain at all.
Right.
But like you said, just switch the doctor. So like my goal is to do that.
Right.
My goal is to do that. Maybe go to someone that's willing to listen to me. Maybe go to a different physical therapy, because the physical therapy that I had, he wasn't really doing anything. He was just, I'm a student. I used to be a student athlete, so like the work that we do was very different. So like the things that I was doing at that place, it was some things that someone that's in their 90s are doing. I'm like, come on, man, like it's not really doing anything for me. Like I don't feel nothing. It's like just moving my leg, not feeling anything. When I go play, pain,
Right.
But yeah, but also because I know breast cancer have been very much focused on compared to like before. So let's talk about, you just being in the industry now and actually seeing things in the lens of like the researchers and so on. How would you describe the future of research in terms of like breast cancer?
Well, okay, so the future, a bright future would be a vaccine.
Okay.
And I would jump into that study so quickly. I would be willing to give myself to science and receive that vaccine. I think that would be wonderful. I think that, and let me say this, that I think that there have been significant improvements, and as you said, there's lots of focus, right? We're in October. It's pink. We're going to see pink everywhere, right? And the only thing I'll say about that is that now working in survivorship and working with people with all cancers, that's kind of hard for them, because it's not like that with ovarian or bladder cancer or lung cancer, right? And those people go through it the same way, right, intensely, right? They're going through chemo and radiation and all these things. And there isn't that same focus, right? You're not seeing it, athletes wearing pink and people, obviously one difference is the numbers, okay? A lot of women will get breast cancer, right? And there's been a lot of focus and media attention, and I think that's great. But I can understand, you talk about empathy, right? I can see, right, how patients could be like, oh, wow,
Right.
like what happened, when is our month, and when do people really pay attention and recognize this type of cancer, right? Testicular cancer, right? What month is that? What color is that?
I don't even know what month is that.
I'm pretty sure it's April.
Oh, so they already have a month for it.
Oh yeah, there's a month for every. Lori, there's a month for every cancer. Every cancer has a month, has a color, has a ribbon. Absolutely.
Wow.
Absolutely. 100%. Every
crazy.
cancer. And so we have a mural in our infusion center, in our Collide Infusion Center. It says, all cancers matter, right? Because they do, right? All of them matter. And I was talking to one time to a lung cancer patient, and he was like, no offense to you, but like you get all the stuff, like breast cancer gets everything, like, and I said, you're right. Like it is, I wish, right? I wish everyone could have the same, focus and attention, and but again, the numbers are very different, and that's part of it. But I think that for this, the other future, you said, what's the future like, right? So a great future would be no breast cancer, none, right? A vaccine. Also would be where it's caught faster, right? And more accurately, right? Like the mammogram is not always great. It failed me. I was going for mammograms. My cancer was probably there for years. Wow. So it failed. And I'm an example, right, of where the mammogram didn't work. So, now there's hope, and there's discussion around multi-cancer blood test. So that you talk about the future. You take one blood test and it detects multiple types of cancer. Wouldn't that be great?
That would be amazing. Especially, like you said, you never know what you have.
So you do a blood test, and it's testing for all these different cancers, So you don't have to, and again, you might not have to go for your mammogram, for your colonoscopy, for your skin, all these different tests, the low dose CT scan. That's another thing that people aren't aware of, Glory, and that is that there is a test for lung cancer. It's called a low dose CT scan. And anyone who's smoked, and please don't vape or smoke, but if you have smoked and vaped and done those things, right, talk to your doctor about whether you're eligible for this CT scan, because again, if it's caught early, the outcomes are going to be much better. And these are things that, we try to push out education and materials, but, the message needs to get spread fast.
Yeah, most
faster.
Definitely. Most definitely, because as you can see now, like you mentioned, vaping itself.
So it's bad.
Vaping is now like the new epidemic. There's so many young people. Let me tell you the craziest story. So I was at this event because sometimes I do throw events, I do host events, and so on. And then there was people just having fun. And this girl just came out of nowhere and asked me and a couple of my friends, "Do you guys have a vape?" I'm like, "What? You're asking from a stranger, so you need it that much?" It's crazy how much people need that so much in their hands. They're constantly smoking it if they don't have it. And recently I saw these girls just run up on stage and say, "Can you charge this vape for me? Like, I need it charged. I need it right now." I'm like, what?
Addictive, right? More addictive, and so dangerous.
I feel like it's more addictive
yes.
than cigarettes.
Yes, yes.
Because cigarettes, yes, they are addictive, but
yes.
I've seen so many people just vape from morning to night. Cigarettes, you can smoke maybe 2-3 a day, or maybe some people smoke a whole box and then they'll wait, which is insane, But vaping, it's like so easy. Like you just go to the corner store, buy the juice, put it back in, charge it, smoke, charge it, smoke, and it's like, and they share it too. That's the most craziest thing, like sharing it also and stuff like that. Like you said, stop smoking. Make sure you go ahead and get those check-ins. Check for those lung cancer.
Yeah.
Because every cancer matters. So you never know what you have.
That's right.
That's
right. And that again, I am fortunate. I am a recipient of all of those women and men before me who had breast cancer and who championed this cause and fought for better diagnostic tools and better treatments and all these things. But at the same time, right? Like, wouldn't that be great? Wouldn't that be fantastic, right? If that was across the board. And I just finished up a challenge, a fundraiser for glioblastoma, which is brain cancer, which is what my dad died of. And there's just no progress. In the years he's been gone, 20, 30 years, right? 30 years, they haven't made significant progress in treating that type of cancer. So anyone who's diagnosed with glioblastoma, it's so unfortunate, right? So how amazing would that be, right? If we started seeing success, right? Successful outcomes across the board, right? In all these types of cancers. That would be the ideal world, right?
Yeah, looking forward to all those successful researches, and just so that we can get rid of this dangerous and the most disgusting disease. Yeah. But yeah, thank you so much, Dr. Wanzer. I really appreciate your time and actually for coming here, educating the people, telling them your experiences. This was a very enlightenment moment for me as well, because I never really thought about men having breast cancer or anything like that. So I really learned a lot today.
Good. I'm glad. Yeah. Thank you for having me. Thanks. This has been great.
Definitely. Thank you so much, guys. This is Easy Pinch Out Podcast. Don't forget to like, comment, and share this video. And then also, I'm going to also actually, your organization, if I can have like the Instagram, if you guys have an Instagram, I could just put it and people can actually tune in.
I'm probably going to give you also the information about the Sisters in Survivorship,
Okay.
right, which is through the Breast Cancer Network of Western New York. Lakia Johnson is actually a graduate of Canisius, and she runs the support groups and is available for counseling, and all of these resources are free because they're part of the grant. So if you know anyone who is looking for support, right, like I said, sometimes you do really well during treatment, but after it's over, right, you kind of have to manage everything that's happened to you and kind of go on with what's called the new normal, which is not really normal at all. It's very abnormal. So maybe I can share that information too.
Awesome. Thank you so much. Yep. So I'll be able to share on my page and so on. Thank you, man.
Thank
Thank
you.
you guys. Y'all have a wonderful day and peace. Let's go.